My name's Azmina, and these days I work for the NHS in a busy hospital helping people to live with and beyond cancer. So what we know from the latest research is that 4 out of 10 cancers are preventable due to lifestyle factors, but that still leaves 6 out of 10 cancers that aren't currently preventable. And included in that group was the cancer that I had when I was 25, which was a very early colorectal cancer. I've always been a non-smoker, a non-drinker, and a lifelong vegetarian. So although I don't think that lifestyle factors were a culprit, I do think that genetics had a part to play, because I do have what's called a family history of colorectal cancer. So it's worth remembering that whilst cancer doesn't always run in families, it can do sometimes, and that's why NHS cancer screening programmes are so important. In England, we currently have cancer screening programmes for breast cancer, cervical cancer and bowel cancer for people who have certain risk factors or who are of a certain age. And the reason they're so important is because if cancer is caught early, when it's still small and hasn't had a chance to spread, then chances are that things are going to turn out okay. Because when they're caught early, cancers are very treatable and they're very beatable. So the cancer that I had was picked up very early by an NHS surveillance programme for people with known high risk factors. And because my cancer was caught so early, I had an operation, but I didn't need any other treatment like chemotherapy or radiotherapy. My big operation has left me with one of these, which is a stoma bag, but other than that, I'm absolutely fit as a fiddle. It's important to remember that not everyone who does have colorectal cancer will actually need a bag. Some people might have one for just a short while, and some people don't need one at all. I do have a bag, and mine is with me for life, but hand on heart, it really isn't a big deal. So even though I've already had a little rumble in the jungle with cancer myself, I still like to do everything I can to keep myself healthy. So in no special order, the things that we can all do are giving up smoking if we're smokers, keep to a healthy weight, eat lots of fruit and vegetables, limit our alcohol intake, be active and stay safe out in the sun. The other thing we can all do is go to our NHS cancer screening appointments if we're invited, because catching cancer early through a screening programme really can make all the difference. Please don't ever be afraid of cancer, and if you think there could be something wrong with you, please don't be afraid to go to the doctor. So for example, if you have lumps and bumps that are unusual for you and won't go away, if you have unexplained weight loss, losing weight without trying, if you have blood in the toilet, regardless of which end it's coming from, or if you're coughing up blood, chances are if you have any of these signs and symptoms, it's going to be nothing serious. But it's better to get yourself checked out and then be able to put your mind at rest. Cancer is not the same serial killer that it used to be back in the 1970s and 80s. I'm proof of that, and there are plenty of others out there who are just like me. So yes, whilst we do all sadly know somebody who's died of cancer, we all also know somebody who's survived cancer. Cancer is treatable and it's beatable.